Assalamu alaikum. My name is Dr. Ehsan and today I am going to discuss about how to clear your cardiology exam. I recently cleared my cardiology exam in November December 2024. So many of the juniors were asking for the guidance. So this is the basically presentation to guide you through the exam. First thing, this was my approach, and alhamdulillah I got cleared. So you can adjust this according to your schedule and your timings. This is not the hard and fast rule. So for the theory exam you will get roughly 3 to 4 months are enough if you are giving 8 to 12 hours per day for, for the exam only, isolated. But if you are doing it with the job, then at least 6 months before you should start preparing for your theory exam. For the theory exam, these are the following books you need to go through. One is the Brownwood reviews. That the This book is from the Brownwood, only BCQ based. Along with that, there is theory for those BCQ. So you need to go through Brownwood review and SEC SAP. This is also the one of the most important books. So are the majority of these two make the majority of the books, around the 60 to 70%. You need to go through these multiple times. For the SAP, what most of the candidates do, I have seen them, they only read the BCQ and they cram the BCQ, they just forget about the theory. In the SAP there is very nicely explained, and in detail it is explained. Examiner can take the question from the SAP theory, or they can alter the BCQ with a different approach. So you need to be present in your exam. If you think this is taken from a pool, then look for the BCQ again, read it very clearly. Do not do the mistake of thinking that I have gone through it, this is the answer. Along with these two BCQ books, you need to revise your theory. No, what I did it from the Elias Hana. You can also go through Topol or Cleveland Board's review. This is also a very nice book that covers all the sections that you can be examined in your FCPS cardiology exam. If you in your cardiology training you have gone through Brownwood, then I don't think you can go through it again for the revision purposes. But if you can, that is beneficial. Now these are the some additional BCQ books that you can go through them. I personally have gone through Mayo and intensive board review, but if you got time, you can go through Ram Das and Hart's manual, and there are some local authors like Dr. Rafiullah. He have also a BCQ book. This is very nice application near peer by Dr. Ali Hamza. You can go through this application and you can revise and attempt all the BCQ. This is very much like CPSP based, and there is also a sole pass paper of Dr. Sanam. Brownwood and SAP are the must. SAP 9 and 11. In the 10, mostly the questions are same. So if you are going through 9 and 11, that would be more than enough. For these, Mayo, ischemia, and heart failure are very much outdated. The written treatment or the question around the treatment are outdated. So if you are going through it, be very cautious. In the Ramdas, there is most of the basic BCQs, but if you are going through all these books and if you are finding any controversial thing, then you can skip it. Or if you are around the treatment options, like in the blood pressure management or ischemia management, then be careful, that might be outdated. For the theory, you should also have good grip on the guidelines. These are the basically four major chunks of the guideline that you need to go through: ischemia, heart failure, valvular, and arrhythmias. I will encourage you to read the ischemia latest guideline. We have also NSTEMI and STEMI from 2017 and 13 of AHA, but we have latest guideline of ESC ACS 2023. You can go through them, and beside that, uh, CCD in the AHA 2023 and CCD of the ESC have also came just a few months back in 2024. And from the valvular, we have only one guideline, that is of 2020 AHA. It is very concise, crisp information is given in the valvular guideline. Now, what I did, I have personally gone through ischemia, heart failure, and valvular extensively. In the arrhythmias, I skipped it because I was short of time, and these guidelines I have gone through in my training. So, also these arrhythmias guidelines are mostly not tested in the exam. Majority bulk comes from these ischemia, heart failure, and valvular, and the minor topics like pulmonary embolism, pregnancy, pulmonary artery hypertension. So you should go through those guidelines as well, which would be the latest one. Also, I would encourage you for the Mayo lectures in on YouTube. There are available of 2020 Mayo lectures. They are very nice, very helpful, exam oriented. So if I personally have gone through multiple times, at least 3 times I have gone through the Mayo lectures. And if you are taking notes, then it would be helpful in the later days before the exam. 1 to 2 weeks you can revise those notes as well. Now, few tips for the theory exam. If you have heard about the Pareto principle, or also popularly known as 80-20 principles. Now, 80-20 principle state that the 80% of the yield is given by the 20% of the product. This means your 20% of the topics will you will be tested mostly in the exam on this 20 topics. 80% of the question will come from those 20 topics. For example, if you will go through your Brownwood review book, you will find that multiple questions have been asked in the cardiomyopathy chapter regarding the amyloidosis. You have hardly seen in your training a case of amyloidosis. At least I haven't seen. Might you have seen one or two. So amyloidosis is very hot topic for them, and amyloidosis is not very common. We usually 15% of the patient with the HFpEF have underlying amyloidosis. So that is very much tested in the exam. Another example is mitral stenosis. We are endemic in the mitral stenosis. We have bulk of patient with the mitral stenosis, which is a rheumatic etiology. You will be going to, they are going to test you very much on the mitral stenosis. Along with that, ASD, very much common. Uh, you are going to be tested on it very much. So, for the common diseases, you should be knowing the uncommon things or the rare things of those common diseases. For the rare diseases, remember the common things are the bulkier things. I am going to repeat this sentence. This is very much important. For the common diseases, remember the rare things also. For the rare topics or uncommon diseases, remember only the common things. So next one is take notes. If you are finding a difficult in the algorithm of anything or BCQ of anything, write it down in your notes and you can go through it later on. Because if you study firstly, it is going into the section of the brain that is temporary. In the long term memory in the hippocampus is stored. If you repeat multiple times through your notes, then it is going to be stored in the long term memory. Next one is the teach others. This is also called as Feynman technique, very much popular. If you are going to remember things by reading, you are it is the lowest level. If you are going to remember things by listening and watching visual assessment and writing, is better one. But if you are teaching it to someone, then this is the best way to remember in long term memory what you have read or gone through. Either you can teach other or you can discuss in groups. But remember, don't make group too large. I guess 1 to 2 people are more than enough. Otherwise, your time is going to be wasted. 8 to 12 hours of study is enough, as I have already mentioned in a day. 50 minutes of study, 10 minutes of break. This is what I used to do. But if you are shorter in attention span, you can study for 25 minutes and take 5 minutes break. In the break, what you are going to do, don't go through the mobile. You can take walk or take a sip of water or have tea or have conversation with someone. This technique is called as Pomodoro technique. It is scientifically based technique to remember things more rapidly. In a week, you need to take a day off. On Sunday, I used to do is that I used to study between 4 to 6 hours, and rest of the day I used to take rest. But if you're good enough, then you can go through. This is basically for the in the long term you are not going to be fatigued. If you have read the 7 habits of highly effective people by Stephen Covey, then the seventh habit is the sharpen the saw. So this means on the rest day you are going to take rest. You are going to re-energize yourself for the next 6 days. you are going to study for 12 hours. Also, make a schedule, make a target day before that I need to cover this whole chapter. Along with that, I need to cover 4 to 5 theory topics in the in this day, and try to cover up everything in that. Avoid distraction like mobile. Keep mobile in your bags or in your car, or buy a mobile that don't have a screen, just the buttons. This is going to help you a lot. What happens in the scrolling, we don't remember the time, and when the library when you are taking off, then you are thinking that my targets are not achieved. This is because you are not thinking about the time. Obviously you have wasted 2 to 3 hours by scrolling through the Insta or Facebook. So keep the mobile at the home, or at the home. If you can study, then study at the home in a room, or if you can't study like me in the home, then you can join the library, and that should be near uh, you, so that you don't need to waste time in the commute. So you have gone through the theory exam. Now what you should do? Now majority of people, when I was giving my theory exam, they just rested until the result came. I took leave for 3 to 4 days, and after that I again joined my library, started studying for the TOACS exam. I guess 3 to 4 days or maximum 1 week is more than enough. Within the 2 weeks or 15 to 20 days, your result is going to be announced. Whatever happens, if you are studying for the talks, you are not wasting your time. If if God forbids you fail in the theory exam, then the time you have given for the talks is for your own benefit. In the future it will help you. So my suggestion is, for the maximum 1 week take off, then again join the library or start studying for the talks. And if you are taking rest, also collect the material for the talks, and buy the books for the talks and for your future exam. Now the next step is of the talks. We have 4 stations in that: the ECG, echo, cath, and miscellaneous. These are basically 10-10 station. The cath and echo are the first 2 stations, and ECG and miscellaneous are the static station. You will be given 10 slides of the cath, 10 slides of the echo, and 10 for the ECG, and 10 for the miscellaneous. Total compile of the 40 station, and there will be 2 to 4 question in the each station. Now in the talks there are two steps. First, you need to identify the disease, and second, you need to write the questions, write the answers. These are basically two different things. Identifying is also very important, and your theory based knowledge is also very important. Suppose if you are identifying the disease or identifying the pathology, this gives you approximately 4 to 5 marks. But if you are attempting the answers for the rest of the question, you will get the full marks on this. For the ECG, first thing I should tell you, never underestimate the ECG. This is what I also did the mistake. uh, we really think that we have gone through training good enough, we are good enough in the ECGs. No, this is not the case, because this is ECGs are the one of the most tough stations. So please go through it thoroughly, revise your books, and prepare it very thoroughly. For the ECG, you can go through the Hasib Raza book and ECG Life in the Fast Lane, 137 common ECGs, and the Q Club is very helpful. There are around 70 stations for this, so these would be the enough for the ECGs. I should remind you that a special focus on the pacemaker ECG and its troubleshooting. Now, one thing that I can guarantee is you that pacemaker ECG 1 or 2 are going to be in your exam anyway. So go through them, and it's also troubleshooting like loss of capture, under sensing, yeah, or over sensing, and also what's the treatment for that and what's the causes of that. So for the ECGs, these things are enough. In the cath, first thing you should do is go through the Grossman. Grossman is basically an application that is going to tell you regarding the views and all the stuff. This you will go through again. So for identifying the disease, and there is little bit theory on that, but if you are going through 1 to 2 times, that is enough. And again, the Q Club, very helpful. You should buy their subscription, and also go through the Q Club. There are also a very nice folder of the Jina Cat. Uh, it comprises about around 120 125 stations. Very helpful, and because the theory is also written. You can also go through the past material. Uh, these things are very much commonly asked in the exam. Complication of the cat's peripheral angio and the graft study. If you are having difficulty in these things, then you can ask for the help of any senior, then he can or she can guide you through the cath stations or basic views. Also, there are uh, Hasib Raza lecture on the talks. Those are around 50, but uh, you will get most benefit from the 40 to 50. And there is lecture of Dr. Arzalan in the talk section around the cath, that was very helpful. For the echo, again, like in the cath you have gone through Grossman. In the echo you should go through Figambum. This is very helpful, very nicely written. You will have good grip on the views and pathologies. In the past material you can again go through once you have gone through this. And the Q Club, very helpful. For the talks also, there are few books that you need to go through, like there is Ace the Cardiology by the Bari, Abdul Bari, and there is Sanam Khwaja book, and there is also book of Dr. Rafiullah. So if you are going through these books, that will give you additional benefit. In the miscellaneous, we have myocardial perfusion scans, MPS by Dr. Sharjeel lecture. Go through that. In the MPS, there are only 5 to 6 things you need to remember. These are also the constant station. One would be reversible, another will be irreversible defect, or they can give you HCM or cardiomyopathy or a high risk feature like RV, lung uptake or whatnot. Another, there is a lecture by Dr. Danish Qayyum from the NICVD that would be also very helpful. If and the X-ray, there is Dr. Hasib Raza book. This is more than enough. There are 55 X-rays. If you have gone through this book, that will be your X-ray station. Not only single thing would be wrong. CAT data, there is Dr. Hasib Raza book, or any presentation from any senior, or in your hospital library you can find. You can go through the CAT data. CAT data is also very much simple. There is strict to that first see the saturation. If there is shunt, then identify that shunt, and at what level is the shunt and what pathology could it be, and then see for any pressure difference. Remember the normal pressures and then shunt. There may uh, 10 to 15 diseases that can also be in the cardiac cath data, like TOF or PS or pulmonary hypertension, PDA, VSD, ASD, AR or coarctation of aorta. Another CT, CMR, you can go through them by the presentation. There is also a lecture by Dr. Sharjeel on the CT that is going to help you a lot. And in the CT, CMR are going to be very easy and very doable things. CT, CMR are not going to be very difficult. And one more thing, there is also cardio TV. There are lectures available on YouTube of cardio TV. You can find the talks material also there by Dr. Zubair, ECG class, and by Dr. Khalil of ECHO. Those are going to be very helpful. And Hasib Raza MIC forum, I have already told you, that is going to help you a lot. In the EP tracing, there is a Mayo lecture, single lecture that is going to cover your EP tracing 100%. Mostly VT, AV blocks, or AVRT, AVNRT, AFib, flutter. These are going to be mostly asked in the EP tracing. So remember the most common in the EP tracing. Try to practice them, and remember, writing is important. One thing is you are identifying the disease, another thing is writing how to write that. These are the both different thing in the talks. So try to cover up these both. So Dr. Hasib Raza MIC forum lectures, I have already told you. Books like Rafiullah Bari and Dr. Hasib in the talks, I have already told you. You can go through. One thing I would encourage you to do practice writing for uh, the 2.5 minutes. Take the timer, and for the practice of writing, you need to see the few things. One, if your writing is clean and neat, and is it readable, and second, if you are doing any spelling mistake, try to correct them. And if you are writing more than what is asked, then try to summarize it whatever that is asked. If they are asking for percentage, write the number of the percentage only. If they are asking for 3 complication, write 3 to 4 complication only. Alright, this is going to help you and give you maximum marks. You need to practice writing 1 to 2 times just to check these few things. I didn't do. I practiced writing for 3 times maximum, and not more than that. So if you are going to the attempting the talks, these are the few tips that is going to help you. One, don't panic. If single station goes wrong, then don't worry about it, forget about it, move on to other station. You need 60 marks to be passed in the to get passed in the exam, and inshallah you will get if you are going to give maximum in the each and every station. um, Another thing that I came across the candidate, if you are identifying something and you are not getting the answer what other things have been asked, so whatever you see you start writing accordingly. If you know the answer of the question number 3, start writing the question number 3 first. Don't think about the question number 1 and 2. Now after you are done with the answer of the question number 3, then again go through the station and see if you can recall that or not. You need to keep calm in the exam. If you are going to be panicking, then it is going to be difficult for you to attempt the rest of the exam. And most important thing, remember, and you need to cram the most common stations. Suppose they are asking for the dissection, you should be knowing the dissection classification or complication of the dissection and causes of the dissection. You should remember on the fingertips. The most common stations or repetitive stations are asked again and again. You need to cram that information, because in the 3 minutes of the talks you can't recall or think if you are not going to remember those things. So cram that every information that is commonly asked. Okay, and that would be good enough. Another thing that I did for myself, and I would encourage you to do, is pray a lot. Pray from Allah or your God regarding to getting the exam passed, because it is very difficult exam. It is doable, but you are going to do a lot of hard work. Imagine yourself being a consultant. Think that you are a consultant, and in the exam appear like a consultant. Another, what I encourage you to do is take beta blocker. If you haven't any complication, you haven't any heart disease or no any contraindication, then you can take enroll beta blocker 1 week, is 1 week before the exam. That is going to help you a lot. This is my personal experience. uh, but if you are not comfortable with this, it's your wish. Reason, I have given multiple interviews and I have appeared in the multiple exams. I know you people also have gone through multiple exams, but every time the sympathetic drive, the sweating, the palpitation, it is difficult to manage sometimes. So if you are going to take the beta blocker, that is going to calm your nerves, and your brain fog is going to be disappeared. First, Theory, and after the theory for the talks you get roughly 2 to 2.5 months for the talks and long shot. Now for the talks you need to, as I've already told, start after 1 week of the theory. Don't wait for the results. For the short cases, start after 2 weeks of talks preparation. Suppose if you have started the talks on 20th September, then on the 1st October you should start your uh, short cases. For short cases, start daily 2 short cases you should do, and you should time it from the day one. All right. Now in the cases, after doing it, tell your partner, and I will encourage you to make a pair of two, so not more than two. So this is going to disturb you a lot, because you have limited energy, you have limited time. So make a partner, and after doing a short case, speak up, and you should be confident enough and smooth enough at the day of exam. If you are start preparing 2 months before the exam, then inshallah you will be smooth enough in your exam, because then these things will be in your spinal reflexes. You don't need to think about these reflexes. In the first week of the talks, what I did, and you can also do this, is master the sequence of the short cases. Like you are starting with the inspection and the palpation, apex beat, thrill or palpable murmur, and then on the auscultation and menu specific menus of the auscultation, like mitral stenosis you need to do the left lateral. For the aortic regurgitation you need to lean and sit forward. For the aortic stenosis you need to check in the expiration and Valsalva maneuvers, hand grip. So master this sequence in the first week. In the second week you can do is timing. You need to complete it in within the 5 minutes. In the third week you can show your short cases to a senior registrar, or those people who have immediately cleared their exam, or to the consultant. For the short cases, I will encourage you to read Dr. Hasib Raza book, or Dr. Rafiullah, or Sanjay Sharma. Sorry for the spelling. Whatever book you are reading, questions are the same. So read any one of the following, and cram the answer for the commonly asked question. Most commonly aortic stenosis, mitral stenosis, aortic regurgitation, and aortic stenosis and ASD. These five diseases should be on your fingertips, and the short question answer should be on your fingertips. For the rest, you can go through them, but they are less common, not that much common. All right, and also I would encourage you to make a uh, good body language. Your body language should be open, and you should face the consultant. These things, if you practice with your partner, then in the exam, inshallah, you will perform good. For the long case, you can start 1 month before. You will be doing a 30 long cases, and those would be enough. In the long cases, you can listen to Dr. Hasib Raza lectures, very, very helpful. Because if you are going through the first time, then it is going to be very difficult for you that what steps to take, what things to take. And long case examination, there are FCPS cardiology long case examination available on the YouTube. You can copy any sequence of the examination from that. So practice full long case history and examination daily. Time yourself within the 30 minutes. For the 10 minutes, give to the history. 10 to 12 minutes. For 10 to 12 minutes, give it to your examination. 5 minutes before you should be compiling yourself. But this is not the hard and fast rule. I myself took history for the 15 minutes and did examination for 15 minutes, and my examination was alhamdulillah completed. Just remaining the uh, standing blood pressure and gait and the fundoscopy. Rest of examination was completed. But if you are confident enough, good enough, you can go through it, inshallah. One more thing that I need to tell you is that it it does not mean if you are completing in 25 minutes or 20 minutes your history and examination you are guaranteed to pass the exam, because you are going to miss the things. And if you are not completing your examination in the 30 minutes, that does not guarantee that you are going to fail the exam. So this is the thing you should keep in mind. And if you are doing daily practice of the long case, then try to summarize it in front of your fellow that you are preparing with. Because if you are going to tell it verbally, then it is going to be helpful a lot. Because in the exam day, you will be very confident and you will be fluent enough. For the ischemia, majority of the candidates get the ischemia, STEMI, unstable angina, and CCD. And I will encourage you to go through guidelines very thoroughly for this long cases. Other things are syncope, heart failure, and eye or valvular. You can go through them and guideline also, but majority prepare for the ischemia. Now these are again very much commonly tested in the long case. You can come across these patients. For I personally myself took the 2 to 3 histories of syncope, heart failure, eye, and valvular. And you can also make a mnemonic for the history HOPC of these things. In the history, start with the biodata, ask for the age and where he is living, and previously co-mobs, marital status. Okay, and in the HOPC, you need to probe deeply for the HOPC. If you are going to ask the chest pain, if he is patient having chest pain, then ask the chest pain everything: site, onset, character, radiation, associated factor, triggering factor, relieving factors. These are very much important. Beside that, you need to ask also pertinent negative if this chest pain is associated with any stress or prolonged bedridden, and or any trauma or fever or any rash. And you should be loud and clear enough so the examiner can hear what you are asking. And then there is sequence of the rest of the history. Past history is systemic history, vaccination, allergy, drugs, and personal. I used to forget these things, though I made a mnemonic for that, like systemic and past, allergies, vaccination, and so on. So, 1 month is good enough for your long case. Practice maximum ischemia. Uh, Show your short and long cases to the past candidates or the seniors or any SR that are going to refine you more. Be confident, be present, don't just do showmanship, doing all the maneuvers and checking the all the boxes. You need to be present there. You need to be uh, handling patient with very gentle, and they are going to see you that are you a consultant or not. Practice maximum, and I will also encourage you to record yourself that how you speak. So what you can do for 1 to 2 minutes with the mobile, record yourself and see how you are doing. After that, you should see how I am, how are my hand gestures. Am I confident enough? Am I loud enough? And beside that, am I fluent enough? Am I using the filler words or not? And later on, you can practice in front of mirror also. So this is also one of my personal opinion. Knowledge is checked in the theory and the talks, and in the long shot, they are going to assess you for the how much you are gentle with the patient. Are you able to pick up the finding like visible pulsation and the cannula if patient is distressed or thrill or heave, uh, uh, and how you are going to present yourself smoothly or not, because these things are going to matter a lot. I myself in the long case didn't do 100%. Would say did 70-75%, and rest of the question were missed from me. So at that time, your confidence, your appearance, if you are well dressed with a suit, with a tie, with the polished shoes, that thing is going to matter a lot in the long short cases. So this was from my side, and thank you very much for the listening. I wish you best luck, and hopefully you will go through it and pass it. Thank you very much.